BCS2 love! TikTok. Hello everyone, my name is Quirante from BCS2 Kistner, and today I will be doing some instructional video or presentation for the Aquatics Retdem. So my case number is case number 30, and it said that self-stretch left lower E to increase hip flexion with the knee extended and strengthen the right shoulder abductors. So let's talk about the equipments that we will be using for self-stretching the lower E. So we have here a pull step, a pull noodle, a rail bar, but if you don't have a rail bar, you can also have a pull wall. So what is the patient position and how do you do self-stretch on the lower E? So I have here a two options so that you have a two alternate position of the patient. So first here you can see the man is standing with his one leg and also the other leg is on the pull step. You can also the safety rail bar so that he has a support so that he cannot fall on the pool. And also, the water of the pool is on the waist level. The second picture shows that the woman is also standing on her right leg while the other leg is on the floating equipment called the foam pool noodle. She has also a support on her back so that she cannot also fall. So the physical therapist position is standing on the left side of the patient. One hand stabilizes lightly at the pelvis to prevent any rotation, while the other hand is used to cue trunk alignment and guide the patient's movement. So how do you self-stretch your lower E? So the knees remains fully extended while the patient gently leans forward from the hips. This stretching targets your hamstrings and your glutes. So this stretch is held for 20 seconds for 3 reps. The equipment that we will be using on strengthening the shoulder abductors are the buoyant dumbbells or an aquatic. For the patient position in strengthening the shoulder abductor, the patient stands in upright position in shoulder deep water while holding an aquatic dumbbell in the right hand. So the physical therapist position is in front or on the side of the patient or maybe in the back. So one hand is positioned near the patient's forearm for safety, while the other hand is placed near the shoulder to cue proper abduction and scapular motion. The therapist maintains a clear view of the movement to ensure correct form and patient safety. So how to strengthen your shoulder abductors? The patient will do lateral raises on the water. The patient slowly lifts the arm out to the side into shoulder abduction, then lowers it back down in a controlled manner. The water provides a natural resistance throughout the movement. This exercise strengthens your middle deltoid and your supraspinatus. The patient will do this for 10 to 12 reps for 3 to 4 sets. So the contraindications for the aquatic exercise is the presence of the open wounds or active skin infections. These conditions are not allowed in the pool because warm, shared water can easily spread infection to others and may irritate or worsen the patient's own wound. Aquatic chemicals can also delay healing, making the environment unsafe for both the patient and everyone in the facility. Yes, you can perform aquatic exercises with this patient. Her osteoarthritis actually benefits from the buoyancy of water, which reduces joint compression and makes weight-bearing exercises gentler and more manageable. Her past ringworm infection is no longer active and was already full treated years ago, so it does not pose any infection risk in the pool, as long as she has no open skin lesions and passes standard screening. Aquatic therapy is safe and suitable for her condition. BCS2, love done. Thank you, Lord Jesus. All glory belongs to you. Bye.